Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD podcast. Tro, today we got a special guy who's done a ton of work, and the irony of all ironies is that we were chief residents. He's a year ahead of me and as a chief resident, then I took over the reins and made the program to go downhill a bit from his wisdom, and then he goes off to cardiology, and then he becomes diet doctor, podcast guy, and he's done so much work. And it's crazy how back then we had this was not on either of our radars to be in this area of medicine, and then he morphs himself again and goes into the mental health aspects of lifestyle. And so he's done a great job. He's been a guy who's been super fit, active. He practices what he preaches. And what else do you want to say, Tro?
Well, you forgot that not only is he a board certified cardiologist, okay, and a board certified internist, he's also a personal trainer. He's gotten personal training certification, health coaching certification. I mean, what else can I say? It's
Does
Bret
it all,
Scher.
man.
Bret Scher, we're happy to have you back on. Absolutely a pleasure to reconnect with you. And I know you're doing some great stuff. I know we're working behind the scenes on some things together, and it's just nice to see you in this new role with the Bazooki Foundation and Metabolic Mind, and putting metabolic health and mental health to the forefront. So can you tell people, just a little bit about that, because that's new and exciting. I'm sure people want to hear about that.
Well, I mean, first, just thank you very much for that introduction, and thanks for having me on. It's really a pleasure to be here speaking with both of you. And I mean, it really is, Brian, it's so poignant to talk about our history and where we started, right? 25 years ago, when we were in residency together, who would have thought we'd be doing what we're doing now, right? If you would have told me that, I'd say, you're crazy. I'm going to go get my regular cardiology job and do stents and prescribe statins. And that's my path in life. That's what I'm training to do. And boy, once you have your eyes opened to the way medicine is sort of lacking in a lot of ways and how we need to really step in to improve it's hard to turn back on that. And so that's happened for both of us. And actually, it's been a pleasure to sort of see you progress and see your journey as I've gone through my own. And then, of course, with Tro, with you, the way you're disrupting medical care, again, if someone would have said, there's going to be this guy who's going to, make everything remote and help people lose all this weight and improve their metabolic health and, do all this remote work, I'd be like, that's crazy. Who wants to do that? But now it's like, why wouldn't you do that? So anyway, that's just my way of saying thanks to both of you, and just to sort of reflect on how cool it's been to be on this journey sort of with both of you. But yes, to get to your question, I'm good at dodging questions. All right, go ahead.
No,
Brian.
can I just say one thing? Your lecture, Low Carb Denver, was hands down the best, in my opinion. And not to poo-poo everything, but it really hit the nail on the head when you went through all of the attributes of how a low carb diet, how can affect metabolic, mental health, and et cetera. I mean, the list was on and on and on. And it hit me that there are very few people who give sort of sophistication to this field, right? Like, I'm a social media punk, me and Brian are on the edge of being booted off YouTube, right? But you give a bit of sophistication to this space, and you did that with the Diet Doctor podcast, and your lecture really hit that home. I mean, you just brought all the evidence together, explained what it was, and I was like, wow, we definitely, I'm proud to be the person I am, the disruptor. I'm proud to be here with Brian. Brian just did a trip to, he gives his heart and soul to his patients and doing missions and philanthropy. But, every one of us is different. But I'm proud to call you a friend and a colleague. I am.
Yeah, and I'll give you one more plug on that. When I was first starting out, I'm like, okay, I can't go talk to a church group. We had this conference we did, and I'm like, hey, Bret, would you do it? And he volunteered and did it too, to give me credibility. He's like, okay, hear from the cardiologist. And the other thing I appreciate, Bret, is that you you're not afraid to go against the current and say, hey guys, look, we have to look at this. We have to assess this. We have to look at the data, because so many people pigeonhole themselves in one area and they're not going to divert from that no matter what the evidence says. So I always appreciate that, you being I don't want to say contrarian, but the one to say, okay, we have to assess this at least and look at it. And if it's valid, then we have to make some changes. If not, then we keep going our course. And I love that you've changed course so many times in your career already, changing tact of what you're doing. It's hard to do, because it's easy to just say, like, we all know, both of us or all three of us could have stayed on the route we were on and made a lot of money doing what we were doing. And then you start realizing, gosh, how much do I want to contribute? And you've shown that, and stepping out into areas that people just don't know about and being on the cutting edge. And that's a scary place to be.
Yeah. I appreciate that perspective. Thanks for saying that. Yeah. So to get back to Tro, what you were saying about the talk at Low Carb Denver, I think that's a great place to start, because the way I sort of see this, where I am now with Metabolic Mind, what you and Brian are doing, it's using nutrition as a medical intervention. And that's what I think is there's sort of this line in the sand. We're almost calling something a keto diet doesn't do it justice in the way that we're trying to use it, because it is a medical intervention. And that takes like a change in philosophy that most doctors, most medical professionals sort of don't have. Because if you tell someone to cut back, 500 calories, you tell them to eat less, you tell them to eat Mediterranean and eat whole foods, like whole foods and Mediterranean can certainly make you healthier, but it's not the same as a medical intervention that changes your metabolism, changes your physiology, and changes your brain fuel. And that's what I think is so exciting about what we're talking about and what we're researching and what we're sharing at Metabolic Mind, really this connection between metabolic health and mental health, and the amazing benefits people can see when you actually change your brain energy, when you change the fuel that your brain is using to use ketones, when you improve your metabolic health with a therapeutic intervention. And so my transition, as you sort of outlined, has been from cardiologist to focusing on metabolic health to diet doctor, using ketogenic diets for metabolic health, to now being the director of Metabolic Mind, which is a nonprofit initiative of Bazuki Group, to really focus on this intersection of metabolic health and mental health, and all those people who are struggling with mental illness, looking for some sort of hope, some sort of treatment. And for us to be able to share resources to say, maybe a therapeutic ketogenic intervention could be that hope you're looking for. And at the same time, to help fund the research so that we have the randomized trials eventually, and we have the published data so that we can change clinical practice. And we were talking offline a little bit, just like how exciting it is to be at the forefront of a movement that can change clinical practice. It's what you both are doing, and it's what we're doing at Metabolic Mind for metabolic psychiatry. So it's a pretty exciting time, and I hope I can just be that messenger to really help people learn about it.
Can you give people, because we had the Bazukis on, and what a touching story. So if you guys have not heard that podcast, go back to Low Carb MD, look up the Bazukis. Matt Bazuki tells his story, and certainly Mom was here. And so just two amazing people, forget about Roblox and how successful that has been, but just two amazing people telling the story of how they conquered and are conquering mental health using a metabolic approach. Now, but I don't even know what metabolic, it's new, right? What is it? What is Metabolic Mind? Can you give an idea of how it started, what its mission is, what the goals are? What is, because I see it all over social media now, Metabolic Mind. There's an APA, sponsored event that Metabolic Mind is doing. There's a lot going on with Metabolic Mind. What is it? How did it start? What are the goals? What's the mission?
Yeah, so it started because of Jan and Dave Bazuki and their son Matt, and like you said, you had the whole episode with them. A situation that often turns tragic. Someone who is having a psychotic break and manic and homeless. Like, how many episodes do you hear about that where they're just never found again? And luckily for Bazukis, this did not turn out that way. And they were able to stumble upon nutritional ketosis as a treatment. And, you wouldn't wish this upon anybody, but I have to say, thank goodness it was them, because they are so generous and philanthropic and intelligent and curious and willing to go against the grain, that they said, look, this helped our son. we don't want anybody else to have to go through what we went through. We want there to be a space, a place where people can go to learn about this. Because Jan spent hundreds of hours researching, how do I help my son? Like any mother would, right? But she spent hundreds of hours looking and was so frustrated. So she wants one place where people can go to learn about metabolic interventions, about therapeutic nutritional ketosis to help people with mental illness. So that's where she came up with Metabolic Mind, to be a nonprofit initiative of Bezuki Group, to provide that information, to be that resource for people looking for information. So we have YouTube videos, we have a podcast, we're going to start a blog and a newsletter, and we have a website. But one of the beautiful things about what we do in my job as Metabolic Mind, we're not trying to sell anything. We're a nonprofit. So we just want to get the information out there. So I'm sharing resources from Georgia Eid and Shivani Sethi and Chris Palmer and Denise Potter and Nicole Laurent. Like, part of it is using all of those resources that they have and just putting it forward so people can encounter it and learn from it, and eventually helping train more physicians and train more dietitians and train more coaches so people are aware of it. Because we're starting to see this groundswell of people saying, wow, this is really interesting. This gives me hope. This is something I want to try. Where do I go next? How do I start? And there's still a little bit of a gap there that we have to fill. So that's all part of the goals of Metabolic Mind, is just to put that information out there, connect people with providers, train providers, educate people, and hopefully change the way, psychiatry is practiced with a focus on metabolic psychiatry.
So can I don't know if I'm allowed to say this. I may get in trouble for saying this. So, me and Dr. Shibani Sethi worked on a case series a number of years ago. And, I've worked on some other case series in the meantime, and, retrospective review most recently. And, I've been trying to sort of get a team together to do a wide, a huge retrospective review of our entire practice. Like, I have a practice that's this is a metabolic clinic, right? Mm-hmm. And we are just practicing metabolic health. There is nothing else here, right? And we have weight loss patients and we have primary care patients who are all metabolically interested. And I put a call out there, like, who can help me? I want to look at the crossroads between metabolic health, mental health, and weight loss as it pertains to, biologic markers, as it pertains to depression, anxiety, food addiction, binge eating, right? And calls out there. All of a sudden, Dr. Shibani Sethi says, well, I've recently gotten a grant. I have some funding. I don't know where the funding's from. She hasn't told me. Okay, I haven't asked, but we are now gotten an IRB approved through Stanford, and we are now running a fairly large trial. And I have to be honest with you, without the support of people like the Bezukis, I don't think this would have ever happened. There was a meeting, maybe I should know about it, maybe I shouldn't know about it, in Miami, where all of my friends were there, getting together, talking about mental health and where this field is going to go. And these things can't happen without a catalyst. And all I can say is I'm so happy to see that happening, because already I know of 2 or 3 projects. I know Nicole Laurent, I've talked to her. She was one of the first grant recipients, and she's done amazing work. We have patients together that I refer to her, and she's done great work with them. I mean, this catalyst didn't exist 2 years ago. And it's nice to see.
It really highlights the disparity in medical research, because we're not a drug company, we're not promoting a drug. So, to get funds for research projects, you have to claw and scratch and just fight your way to try and get some little grants here and little grants there. And then a family like the Bezukis come along and say, okay, we're going to start funding research and we're going to start giving out grants. And we need more of that, right? I hope people see that and see that example. And we're like, wow, look at this impact one family can have. This is incredible. What if we did the same for this field we're interested? Or what if, we got a conglomeration of families together to help start funding research? And I wish we didn't need it, right? I wish there was some other way to do it. But when when it's all dominated by drug companies, you actually do need it. And the government and NIH, they can do so much, but same sort of thing. Are they really going to focus on nutrition? Are they really going to give enough money to do the right studies? You need outside forces. And this is sort of what, Gary Taubes tried to do with Nusi back in the day. And we learned a lot of examples from Gary. He's been really helpful with us to share what he's learned about how we can do this, how we can do it better, hopefully in the future. So yeah, you bring up a great point that because of the Bazooki Brain Research Fund, we really are sort of starting this new era of research. And it's something I talk about a lot at Metabolic Mind. Look, there are people who need help now, who are desperate for help now, and we need to find a way to help them. They don't want to wait for the research. So we have to do the best we can with them. But if you want to change clinical practice globally so that every psychiatrist knows about this, every primary care doctor knows about this, that's where you need the research. So that's why we really have sort of this dual focus about helping people now and helping from the research. And that's where we need people like you, because you can't start with, a 10,000 person randomized controlled trial. It's not going to start there. We have to start with the case series, with the clinic analysis and the retrospective analysis. And talk about bravery with you publishing a case series about using therapeutic ketosis or a keto diet for eating disorders, right? That's been from day one. You've probably heard the same thing I have. A keto diet is contraindicated for eating disorders, period, end of discussion. But you went ahead and published a case report. And now we have more case reports about it with anorexia. We just did a whole podcast with the clinicians who ran that 5-patient case series for using ketosis for anorexia. Like, none of this would have happened if people weren't really willing to sort of think outside the box and go against what they're being told. So it takes brave practitioners to start the whole process. And then eventually that leads to the bigger trials, which can lead to a complete change in clinical care. Like, I never want to hear again that a keto diet is contraindicated in eating disorders. Absolutely not. Doesn't mean anybody can try it and it's completely safe and needs no supervision. No, there's definitely a middle ground, but we can no longer say it's contraindicated. Absolutely.
Can I just, I'm going to toot your horn a little bit more. What better person to say that than a board certified cardiologist? Like, the biggest fears around the ketogenic diet are around lipids and heart health. And, like, you are like the perfect face for somebody to be doing what you're doing. And it's nice to see when you're out there at APA talking about this, or when you're, at Metabolic Mind talking about this. I think it's going to have an impact that a lipidologist, cardiologist, personal trainer is saying, hey, this is safe for you. This is something you should consider, with your physician's supervision. And I want to come back to the point you made. We need brave physicians. And I gotta spread the love to Brian, because, we were asked to talk about this, to talk about its effect on alcohol, to talk about its effect on pornography, its effect on mental health. And we did this 4 years ago, and literally, I saw a tweet saying Brian should lose his license, right?
Yeah,
and yet we brought them on as guests. Like, give your testimony, let people hear it, and it's just amazing to see where we were, which was me and Brian should lose our license 5 years ago, to where we are now, where actually they probably still say that, Brian, it's just another topic, maybe, but maybe not.
Yeah, I think it's, some of those people have been on the wrong side of history every dang time they speak. Every time they're wrong. And so, but at the time they may have looked like possibly could have been right. But that's why when even me, I was a skeptic, because I was seeing depression, anxiety, stress, all these other things, getting better sleep, alcohol abuse, drug abuse, pornography, all these things. And then Chris Palmer starts talking about treating schizophrenia with a ketogenic diet. I'm like, this guy's over the top. This is going to hurt the cause, right? That was my first thought until I talked to him and said, well, what's your reasoning? And then he starts going through it. And even going back to anorexia, I think part of it is when you're anorexic, you go into ketosis. You're not eating, you're going to ketosis. And it's calming and people feel better. So if you're depressed and anxious and stressed in a hard life, and you automatically, you're going into ketosis, you feel well. When you start eating, going out of ketosis, you feel stress out again. So maybe there's this therapeutic effect, obviously there's bad side effects of that, because we want to have a nutritious diet. And I think that's what I've always loved about you is really saying, okay, what's a healthy diet? Let's not be tribal. Let's not say, even me, I'm going through a change in to a degree that, I changed the name of my company from Low Carb MD to Metabolic Health, like San Diego Metabolic Health, Arizona Metabolic Health, because really it's not just, you can't just say, here, eat low carb. Instead of having brownie, have almond brownies instead of flour brownies, and you're going to be a happy person, right? There's a lot more to this, and the mental part. And like it or not, I mean, the reality is, after what we've been through the last 3 years, we are in an epidemic of mental health crisis, right? The number one cause of disability is mental health. It's not hurting your back or your knee. And so we have to step back as a society and focus on this. And that's why I'm so glad that you're at the cutting edge of this, because we have to push it forward. We cannot have depressed. You tell someone who's depressed and anxious that you have to exercise every day and cut your calories to 500 calories, and forget it, because that's their medication. You're taking them the only thing that makes them feel good, you're taking away, is like telling a cigarette smoker, you can never smoke again right now, right? And I'm not going to give you anything to fill in that gap. And the mental part of it's so huge. And again, Tro and I have from day one said the number one cause of failure is lack of family support and stress, right? That's when you go, forget it. I'm not doing this. It's not worth it. I'm just going to eat cookies.
Yeah.
But then you eat the cookies and you get inflamed in your brain and you get worse and worse and worse. Then you self-medicate more. Then you can't get out of that pit.
Well, I want to bring up one point. There was a study in 2020 that showed an almond-based low-carb diet does improve depression in people with diabetes. So just an FYI.
Okay. Yeah, just doing that. But I mean, there's more to the story than that. Totally.
Yes, absolutely. I agree.
Yeah. Well, and Brian, you brought up the most common reasons for people not being able to adhere to, long-term. And I'll throw one other one out there, and that is they hear from their other doctor, the specialist that they're seeing, or their neighbor who's a doctor or whatever, like, oh, that diet's going to kill you, right? That diet's going to cause a heart attack. That's another reason they instill doubt. And you hear that and you're like, whoa, I mean, I know that sounds scary. That's not worth it. And that goes back to what you were saying, Tro, about having a cardiologist, spreading this message, which hopefully does have some impact. But, anybody can look at the literature. Anybody can look at the science. Anybody can see how to approach this. And I just launched a video today about this at Metabolic Mind, that, this assumption that it increases cardiac events and cardiovascular risk is a faulty assumption. There is no evidence to show that. It all comes down to the surrogate marker of LDL, which the majority of the time actually doesn't even go up. And that's the assumption, which is so wild that doctors would be like, oh, that keto diet is going to totally raise your LDL and cause a heart attack. Well, one, there's no evidence it causes a heart attack. And two, if you look at the meta-analyses for most of the randomized control trials, or even non-randomized control trials that have been done, the LDL does not go up, or at most it goes up by 10%. And there's that one trial by Verta Health that showed even though LDL went up by 10%, ApoB didn't change, and calculated cardiovascular risk went down 12%. So where is this coming from that it is a guarantee to, cause heart disease? And that's a big part of the message I want to spread. And the other part about that is, look, everything we do in medicine is a risk-benefit analysis. Every drug, every surgery, every intervention is, what are the benefits, what are the risks? Well, you guys probably saw this, that keto-like diet trial that, 25% of calories as carbs, and had nothing to do with ketosis. But yet they had a quote in one of the lay press articles from Dr. Christopher Gardner at Stanford saying this study shows that the risks of a ketogenic diet outweigh the benefits. And that one I had to read that a couple of times. Did he really say that? And I really hope it was taken out of context. Because one, it wasn't even a keto diet. But two, how does he know what the benefits even are? Like, how can you say the risks outweigh the benefits when you have no idea what the benefits are? So, like we're saying about, what you published, Tro, and what others have done about, the first treatment people with eating disorders have ever tried that worked for them was ketosis. So if there's any increased risk, that is an enormous benefit. So how do you weigh that risk-benefit analysis? You can't make comments like that until you know the benefit. Ask Matt Bazzucchi if a 10% increased risk is worth it. He would say, I'm sure he would say absolutely, because nothing else that he found treated his bipolar symptoms. And so it's an assumption that there even is an increased risk, but you've got to know the benefits. And we are seeing some profound benefits, as you are. So it really helps reframe that risk benefit discussion.
100%. I mean, I think one of the things that I mean, I've talked about Gardner previously. I've written a letter to the editor about him. He's now on the dietary guidelines committee, which is, what I think is unfortunate. And what he represents, this is nothing against him. What it represents is a systemic bias, right? That's in our field right now. There's just a systemic bias against people changing diets, despite the common mantra being any diet you can adhere to, and I'm using air quotes because that's been the common mantra. Nobody has thought to, like, as physicians, that maybe we should try to help our patients adhere. Like, maybe we should actually try to help our patients adhere. And there does seem to be a lot of bias against the ketogenic diet. And I don't know whether it's interest. I don't know if you have any comments about why you think that is. But I can't seem to come up with any good reasons why there's a bias against it. In fact, even the European Society for Diabetes, and endocrinology, they don't even acknowledge low carb diets as a option there. Isn't that crazy?
That is crazy, especially with the American Diabetes Association at least acknowledges it. I can't believe the European one doesn't. That's wild.
I mean, it's just crazy. So how do we get to this place where carbohydrates don't affect diabetes and a ketogenic diet is evil? How did we get there?
Yeah, I mean, look, Brian, if you and I started on, if we'd stayed on the same trajectory that we started on, 25 years ago, we'd probably be thinking the same thing, right? Because that's what we're taught. We're taught fat is bad, especially saturated fat. But even back then we were taught all fat is bad, and you need your carbohydrates and your healthy whole grains. And this has just become a part of what people believe. And we rely on these really poor quality nutritional epidemiology studies. And we think that's science that can inform decisions. And it's just because we've gone that whole path, it's hard to backpedal, with big organizations making these recommendations, with physicians practicing this way for decades, and telling your patients to eat this way for decades. It's really hard to walk that back. And with, all you have to do is look at the American College of Cardiology, American Heart Association, all these big groups, and see where a lot of their funding comes from. It's not from people who raise cows. It's not from people who grow broccoli even, right? It's from people who make drugs and people who make cereals and people who make processed foods. And that's just wrong. So until we can undo all of that, which is a huge spider web to undo, we're going to have resistance, no question about it. And that's why we need voices like yours. And that's why we need Metabolic Mind. That's why we need, these conferences where we can show data, where we can present things in reasonable ways to say, look, we need to look at this differently. And it's a hill to climb for sure, but we're all doing it and we're making progress. There's no question we're making progress. Yes, we would like to make faster progress, of course, but we're making progress.
I think it's hard. The people I respect the most, they looked at the data, like Professor Noakes. I could go through Asim Malhotra, Ira Cummins. People have looked at data and said, okay, let's look back. And I think the problem with medicine, one of the big problems is we've abdicated our responsibility. The practicing physician's so busy, so stressed, in such a hurry, you don't have a life. So they're not looking at the studies. They're just saying, oh, what does this big governing body say about the studies? And okay, I'll just follow that without actually looking at someone like you go through it with a fine tooth comb and you go like, oh, what about this? They didn't say that these people were on, these seed oils that are highly, toxic or whatever. And so most people just read the headline and that's it. And that's why it's hard to change, because the headlines are always going to be with the narrative. It's not going to, the big headlines aren't going to change.
Right. I mean, and it's a perfect example of how the headlines even are manipulated, right? That diet where people were not in ketosis and they were eating 150 grams of carbs per day, but the headlines were keto diet increases heart risk and nothing to do with it. And again, it goes back to that inherent bias that you mentioned, Charles, that there is this bias against keto diets and it's pervasive in the medical community. And that's why I really like to talk about therapeutic ketosis and talk about what a keto diet does. It produces ketones. It improves your metabolic health. It lowers your insulin. And it's this medical intervention that you don't get with other diets. The Mediterranean diet may be healthy in certain scenarios, but it's not going to put ketones in your brain that your brains can use for fuel. It's not going to dramatically lower your insulin levels and allow your body to run with a more efficient fuel source. That is a therapeutic, nutritional, ketogenic intervention.
Yeah, and we look at risk factors as we get older, the things we fear, dementia, dying of heart attacks, all those kind of things. When we look at a diabetes and poor metabolic health or dying of an infection, we're at major risk. So those are the things we can attack from a metabolic standpoint, right?
Mm-hmm.
They're calling, diabetes type, Alzheimer's type 3 diabetes now, right? And so there's all this stuff we say, well, this chronically high sugar in the brain is going to cause a problem down the road. And that's why when you go to these small villages in the southern Italian, near the, where they're all chilling and not as stressed, and they're not, it's a big picture. It's not just what they're eating necessarily.
Yeah. It's about how they live their whole life. Right. And I guess the other issue we're talking about sort of challenges and barriers and biases is, what psychiatrist knows about checking insulin levels or Kraft tests or, glucose tolerance tests is not in the lexicon of psychiatry. And what primary care doctors know about, changing the doses of lithium and Zyprexa, and, not many, it's like, we'll let the psychiatry doctors take care of that. And the psychiatrists are like, well, we'll let the primary care doctor take care of that. Well, we need to bring this together and talk about metabolic medicine, and whether it's about your type 2 diabetes, your insulin resistance, or your psychiatric condition. Metabolic medicine can address it all. And that's a lot of what you're doing, Charo, and you too, Brian. I mean, you focus on metabolic health, which everybody thinks, okay, I'm going to lose weight. But you don't just lose weight, you improve your type 2 diabetes. And as you've shown in your practice, you improve your depression symptoms, your anxiety symptoms. And it's metabolic medicine is what it is. It's not siloed as to certain disease processes.
Yeah, our next hires, we're hiring a PA and a physician, but our next hires will be mental health counselors and a psychiatrist.
I love to hear that.
Those are our like strategic sort of objectives, because also, even from a perspective of weight and weight loss maintenance, I mean, the number one reason for people to struggle with weight loss maintenance in our practice is managing stress, managing anxiety, managing their mental health. Absolutely. These are, I think, more and more we need to work together, and hopefully more and more sort of medical groups form between doctors, hint, that so we can work together through some sort of either, medical service organization or something else. But we need to come together and figure out how we're going to do this, because you working out in San Diego and Brian being in Arizona and San Diego, and, having Nicole Laurent, who we mentioned, in Washington, and, Rob Sivas in Florida, that's not going to work, or it's not going to work for long, So we got to figure out ways, in my mind. It sounds like the philanthropy we've got figured out, but also pragmatically, business-wise, how we're going to work together. That's so key.
How do you think it was devastating for me when I was the only one doing this low carb stuff, and then I figured out Bret's doing it, and then he goes to Diet Talk. I'm like, oh, now who do I send my people to? Because every other cardiologist is like, what are you doing? This is crazy, right?
Yeah.
And so it's a hard thing until we build a community of like-minded people who understand it. Because again, going back to the mental health, and I'm so glad you're in that area, is that if people are stressed, they eat more. If you're a stress eater, then we have to work on the stress. We can't just tell you to eat this, because when you're stressed, you don't care. It's like when you're drowning, you don't care about other stuff. You're just treading water. And I think that's a huge thing. And I think we really, really have to address the mental health part of it. People don't realize we're just at the crux of this happening. This wave is coming of mental health disorders after what we've been through with lockdowns and masks and social distancing and all these things, where breakdown of communities, churches, all where people were getting their sense of community. And that's the other thing. And, Malatra has been talking about that too, is when people don't have a sense of community, cardiac risk goes up, everything gets worse.
Yeah.
when we're not connecting with each other.
And I think it's really interesting to talk about it as mental health, because mental health is a very broad topic, or you could even say brain function is a broad topic. And that's one thing that's so interesting about a ketogenic intervention. Like, it helps with epilepsy, and it helps with schizophrenia, and bipolar disorder and anorexia and anxiety. And, it's not like you have the schizophrenia part of your brain or the anxiety part of your brain or the epilepsy part of your brain. It just helps with the brain, right? So it's sort of vague, but it helps with brain function. And then all these other things are like downstream effects of helping with brain function. And I mean, look, you can look at it from an evolutionary standpoint and say our brains were meant to be in ketosis, at least part of the time. It's how we've sort of evolved. So we have to get back there. And again, that's not everything, right? If you're in ketosis and you get fired from your job, or you have a messy divorce, or your kid gets sick, life still gets turned upside down, whether you're in ketosis or not. Now, it may help to some degree, but you need other coping mechanisms. And that is exactly like you're talking about with community and with having the tools to help cope with that. So it's one piece of the puzzle and one tool to help people.
Yeah, I think
I think that's a key. Oh, sorry, Toro. I think that's a key, just because so many of my patients now, something devastating happens in life, and they said, if this happened a year ago, I would have lost it completely. Said, I'm handling it better. I can actually think, and I could focus, and I can look at alternatives, and that's something to give for someone to have that mental clarity, or to feel healthy physically, that they feel like they can get through this. Other times people were just exhausted and they just couldn't cope, and they lay in bed all day. It's amazing to see. Tro, sorry, go ahead, man.
No, I was just thinking like of all the different cases of, people with anxiety, OCD, depression, gambling. I've seen gambling addiction improve, pornography, as we mentioned, alcohol. There's been another one that we've seen improve. All these things we've seen improve. And there's been bits and pieces of evidence in the literature that have come out since then. Volkow did a study at the NIH with alcohol. There's been that great case series from the inpatient hospital in France on bipolar, schizophrenia, and just sort of showings that hey, look, you're right. It helps the brain. It helps with seizures, it helps with migraines, it helps with mood, helps with depression symptoms, and we're not exactly sure how. Right? I mean, we're not exactly sure how topiramate helps with binge eating, migraines, seizures, but yet we use it. So I all I can say is I'm so happy to see you at the forefront of this. I can't think of somebody better to do that. And I know Chris Palmer is working very closely with you as well, another pioneer in that area. So just overall, happy to see you doing that.
Yeah, and we've got an amazing board of advisors with a clinical advisory board with Chris Palmer and Georgia Eid and Shivani Sethi and Nicole Arant and Beth Zubek-Kanya. I mean, those are 5 amazing individuals right there who have been doing this for years, if not decades, and have so much experience and knowledge. And then you mentioned that the meeting in Miami we had, where we had so many experts in the field of research about how do we forward this, research community. And to see so many interested individuals. And, because eventually you have to affect clinical guidelines. Eventually you have to affect what's being taught. So we want to get there. But like I've mentioned, in the meantime, there are just families and individuals who are desperate for help. And that's what we want to provide the resource for people to find and hopefully find a way to help their loved ones.
I was going to say, yeah, go ahead, Brian.
Do we have any more steps forward in what you're seeing? Because one of the things I've commented a lot on this podcast over the last 4 years, I've seen people go from, for instance, a standard American diet, who are majorly depressed, anxious, have all kinds of stuff, and they go carnivore. And all of a sudden, they're doing great. Brett Lloyd is one that comes to mind off the top of my head, a guy who has struggled his whole life with wanting to not be here anymore. And then now he's thriving and doing things he loves to do. What do you think the mechanism? Do you think it's something we're taking out, something we're putting in? Do you think it's chronic inflammation in the brain? I mean, have we moved forward to say, okay, this is the path other than ketosis, any other vitamins or anything that we're seeing that could be causing this?
Yeah, what's so interesting is when you talk about nutrition and brain health, you can talk about lots of different things. Is it folate? Okay, yeah, there's research showing folate plays a role. Is it omega-3s? Sure, there's research showing that's a role. Is it the ketones? Yeah, there's research showing that could be a role. Is it the, neurotransmitter changes? Is it the GABA glutamate ratios? Sure, that's affected. Does neuroinflammation go down? Yes. So there are all these different things. Can you say it's one thing? I mean, it's all related. But this is part of the interesting discussion about, what clinicians think, what researchers think. Do we need to know what the one thing is, or do we need to know it works? And we need to, you start someone on therapeutic nutritional ketosis and, their symptoms improve. As a clinician, I don't care if it's the neuroinflammation or if it's the GABA or if it's, the ketones or whatever. I care that they got better. But I could see how researchers would want to know. And you'd want that information so you can maybe design it a little more strategically or one way. But for me, when I think of mechanisms, I think so many mechanisms are designed so we can create a pill to duplicate this. That's what a lot of mechanistic research leads to. And I don't want anything to do with that, but I'm still interested in the mechanism. So maybe we can design the nutritional intervention a little bit differently. But the number one thing to know is that when your brain is in ketosis, you have all these downstream effects. So let's get the brain in ketosis. Let's see what happens. I did an interview with Matt Bazzucchi, among others, for their top tips of treating mental illness with ketosis. And Matt's top tip was just try it. You will never know what it's like unless you try it, and you just have to experience it. And if it doesn't work for you, okay. But for a number of people, it is going to be a dramatic change and they need to know it. So just try it. That was Matt's number one advice. And on the surface, it seems super simplistic, but when you hear him explain it that way, it's how else would you know?
Can I tell you something? So that's exactly what we're looking into in our review. We are basically taking several biomarkers, including folate, B12, vitamin C, vitamin D, homocysteine, methylmalonic acid, all of these nutritional markers. And we're looking at markers of metabolism, right? Insulin resistance scores, insulin levels, HOMA-IR, right? And we're also looking at inflammation, CRP, ferritin, ESR, right? Because we've systematically collected these, and we are looking to see what will predict sort of mental health outcomes better. What will predict depression better? What will predict food addiction better? What will predict binge eating severity better? And what will predict? So we have, phase one, and we're nearing completion of the data review now. Phase one will be looking at that exact question that you guys are answering, that you're asking. Mm-hmm. And without the help of people like Shabani Sethi, without, my staff, I have 10 people on our staff now, actually 12 people on our staff. I had to each person spent about 10 hours doing chart review, right? Just think about the man hours that goes into this. Nobody's paid us.
Yeah.
And right. If there's no money and nobody's curious, right? I happen to be not interested in being a great business person, but if there's nobody funding this, nobody's going to do it, except crazy people like the three people here. That's pretty much it. There's not. So I appreciate. So one, we're going to have an answer for you soon, okay, on the mechanism, okay, or at least we'll have some more answers than we did before. But two, we need help.
Yeah.
We need help.
Yeah.
We need other people like Bazzucchi's. We need other people who see what it is, the value of what we're doing, to step up.
If you asked me to give you terrible business advice, I would say have your staff spend tens of hours doing work that is going to show no income for you. That's the best terrible business advice I can give you.
Most doctors are good at failing.
But if you want advice on how to change the world, how to change how we're practicing medicine and how to, wake doctors up to all this, then that's the advice you need. And so I guess the next question though is, once you have that information, what do you do with it? So, there's not one answer, but what are some of your thoughts on what you want to do with that information once you learn it?
Yeah. So, that's like the next step of research, which I don't want to go too much into, but the idea is, can we have an impact, and which one of these parameters have an impact on people? on clinically, and can we figure out, what it is? Is it the inflammation that's getting better? Is it the stable blood sugar? Is it the ketones? Is it all of the above? Is it a combination of them? Is it,
I know what it is. It's the patient getting better.
Bingo. Yes.
That's ultimately what it is. When you see it, you go, hey, it's working. Let's keep. But, ultimately, I think the great thing with you, Bret, the great thing I'm really excited about is ultimately we'll be able to look and go, okay, look, is it strict carnivore? Is it adding an avocados? What do I do? Because a lot of people are willing to do it. We just don't know what a healthy diet is, right? Because there's so many different views. Like, oh, you have to be pure vegan with no fat. Oh no, you have to eat only fat, or you have to. So it's so hard. You go, okay, what is the optimal human diet ultimately? What is it that we're going to get our best mental health without trading out off cardiovascular health or diabetes and all that? Then we say, okay, let's go towards that. It's not. What I find is some of us can be so good and so strict, but it's maybe not in our benefit sometimes. To be too strict or too restrictive.
Right. And that's a great point. Knowing sort of the dietary structure, like the minimal required product, so to speak, or, the extreme example where maybe it no longer works, or, somewhere in between, like where are those levels? But I think the important part is, though, it's a different discussion than the discussion that is kind of pervasive now for, nutrition, or I guess you could say nutritional psychiatry, that, blueberries are good for anxiety, and, a fish is going to treat your depression. Okay, well, maybe, but if you're eating your blueberries with like 5,000 calories of refined carbohydrates, those blueberries aren't going to do a darn thing. If your fish is, fried and you're eating it with a bunch of French fries, that fish probably isn't going to impact things. So we like to get very reductionist and be like, oh, this one food is good for you and is going to help things. But no, we can't talk about nutrition that way. And I think that's a big fault about, nutrition and medicine in general, how we have that discussion. But instead, it's sort of the whole dietary matrix and what that does to your body. So that's to your point. Do you need to be carnivore? Do you need to have zero carbs? Or is it just a state of ketosis? If you're getting into ketosis with your almond flour brownies, is that different than getting into ketosis with, steamed broccoli and a ribeye or whatever, right? So there are these different variations, and we're going to learn a lot as we get more. I think right now, my focus, though, is on the state of therapeutic ketosis. Get there however you can get there, and let's see what effects it has on your brain. And then comes the individualized part. And this is where it's a little hard, because you can't just give general advice. This is where you need to work with physicians like yourselves, with, dietitians like Denise and Beth and so forth, where you can make those individual tweaks so that you can sustain it long-term, both sort of logistically and to see the benefits.
Yeah, I think that's key. How do you sustain this long term? Whether it's mental health, weight loss, diabetes, doesn't matter, right? Mm-hmm. Doesn't matter, right? The name of the game is, how can you sustain this long term? And that means owning, the journey of a patient. That means actually caring about the journey of a patient. Mm-hmm. And, this is something that's not easy to do and not rewarded. Right. And
the clinician has to have time to do that. That's the problem. No one has time. So it's a bag of worms. They're like, you know what, let's not talk about nutrition and lifestyle and all that. Here's a printout, go do this, and we'll see in a year. Right. That's what they're doing. And that's what I'm seeing people get worse and worse. And then we finally give them some accountability and some control over what they're doing. Because, again, I just saw a patient. We're doing great with her. She's fantastic, and she's doing everything she can. And she has a lot of things against her, but they just said, you have a chronic progressive disease, deal with it. Here's more and more. They escalate her insulin. She's gained 25 pounds. Now she's lost, 18 pounds of that already, and tapered her insulin down. Her sugars are better than they were on huge doses of insulin. When you start seeing that, you go, gosh, darn it. Like, how many people really are we shortening their life by not managing them correctly, or waiting until they have neuropathy and all the side effects that we see, and then trying to do something. It's unconscionable. It really is.
Yeah. I mean, both of you get a lot of credit and a lot of attention for focus on metabolic health, focus on low carb. Sometimes you get some criticism about the way you portray it, but it's so clear that at your core, you're both such staunch patient advocates, and you will do anything for your patients, and you care so much about your patients. And that's where it starts. I mean, it has to start there. And you guys are both just fantastic examples of that.
and curious and against the grain, right? I think these are the things it takes to get here. You know, if you think about it, what does it take to get to the place? Like Brian's got a, you know, successful practice, and you've had, you know, amazing success at Diet Doctor and now Metabolic Mind, and you're seeing patients in your telemedicine clinic. But, you know, if you look at it, what did it take to get here? It took, you know, caring about your patients, one, being curious, two, looking at the evidence, three, and not being afraid of going against the grain, being, you know, brave and courageous, I guess. You know, I think it's just harder for us unrefined, you know, I should suck for myself, from less refined folk, you know, because Brian's refined, you know, Brian's refined. 100%, you know, 100%.
Yeah, I think it's like, you know, it's one of those things. We don't want to go to battle. I think some of us, I think Bret's in the same category. We'll kind of just turn the other cheek for long enough. At some point when you're cornered, you have to fight. You have to stand up and go, look, here's the data. You have to be like Dr. Unwin and go, here's the data. I'm not going to yell at you, but here's the data. Here's what I'm seeing. And so no one can argue that he's had such great success and quietly did it while everyone said he was killing people, you know? So many of these people, you know, they're actually the ones killing people. They're the ones who are, you know, but they just won't change. So I think you both give me hope for the future of medicine if we can stand up and say, okay, look, here's what everyone's saying, but let's look at the data and see what it shows. And I think that's a skill that most doctors have lost. They just can't look at the data. They can't be open-minded. They already are gonna, like, they've already had their minds made up before they look at the study, instead of saying, let me just kind of pick it apart and look a little deeper under the hood. So yeah. You know, I think you guys are both doing great work, and I think you're on the forefront of what's really matters, because ultimately, if you're a miserable person, if you're miserable and you hate life and you're fighting with people all the time and you hate your job, and your health is going to suffer. Stress, depression, anxiety. If you look at the risk of a repeat event after a heart attack, depression's like top. And so you look at depression, anxiety, stress, and so it's one of those big things. We have to look at the big picture and not just do one variable and go, okay, do this. Like, you know, I love Ben Bickman. He has 5 things that he talks about for longevity. All those things, if you address those, lowers your insulin, lowers your cortisol, you know, gets your oxytocin elevated. And so it's kind of figuring out, okay, do I have to be so, you know, I'll tell you, you know, and Troy, you know, it's true. We have patients who count every single macro, everything they do, and then they crash and burn because it's so onerous. Like, they can't just live their life at some point. You got it. You can be so strict and say, well, I what percentage was this cow grass fed or not, you know, instead of just going, okay, you know, every once in a while you kind of have to eat a sizzler or something, you know?
Yeah. Well, I'm glad you mentioned Dr. David Unwin. Tro doesn't mind a scissor. I don't either.
Don't mind it, yeah.
Well, I'm glad you mentioned Dr. David Unwin, because if there's like one shining example of someone who is, you know, cordial and respected and refined, but getting the message out there in such an important way, I think he is that individual, which I think is great. And, you know, a funny story just came up about last night when you talk about how it's sort of multifaceted and you have to control your stress and how that's all related. Like, I don't know why, but one of my biggest stressors is Little League baseball. Coaching my son's Little League team is like so stressful for me. And last night, you know, we had a tough day yesterday and came home, and like I started sort of stress eating. Of course, it was keto chocolate, but it's keto, you know, stress eating nonetheless. And my wife looked at me and she's like, are you stress eating right now? I'm like, it's Little League. I can't help it. It's Little League. So we all have our triggers. We have to find a way to address. And but
the kids out there picking flowers, and they're picking flowers out there in the outfield, and the ball goes by them, and it's amazing.
You got it.
How old?
And that's the thing. Yeah.
Wait. How old are your kids? How old are your kids, Brett?
Well, it's my youngest is 10, so he's the one who I'm coaching right now.
Got it.
And, you know, I do it so that he could have a good experience and really enjoy it. But I just get too into it. And then my oldest is 13. Yeah.
Okay. So that's troublemaking age. You're lucky you're still cool, you know?
Yeah.
Right?
And that says a lot too, taking the time to coach and to be out there. You know, a lot of people don't have the opportunity to do that. So, you know, that says a lot to your kids too, and that will save a lot of money in counseling and mental health issues down the road. You know, that's important stuff. You never forget that, dad coaching. And even though we had bad games and all those things happen. Yeah, but you know, it's awesome. It's awesome. I'm so happy for you and all you've accomplished and all you're doing and all that you will accomplish. So any way we can support you, you know, we're all in for sure.
Yeah.
I
So
appreciate
what
that.
happens next for you, Bret? And how do people reach you? I didn't realize you're still practicing, but you are still practicing, taking care of cardiology patients, lean mass hyperresponders, and people with coronary disease who are looking for a doc who's not going to bias them and give them the same lines Gardner may. So how do people
Yeah.
reach you? And
Well,
how do
for
people
the
find you?
practice, yeah, for the practice, I'm at lowcarbcardiologist.com. I'm not in 48 states like you are. I'm in California, Texas, Arizona, Utah, Colorado, Illinois, Ohio. Those are my states. So if you live in one of those states, I can see you in my telemedicine practice. But most of my stuff now is all at Metabolic Mind. So the Metabolic Mind YouTube page is where we're putting all of our content, and we have our Metabolic Mind podcast, and then metabolicmind.org is the website. So those are the main areas to find me right now.
Awesome.
Oh, and
awesome.
you mentioned APA. So if anybody's going to the American Psychiatric Association meeting in San Francisco coming up, what is it, like May 20th or something, we're having a metabolic psychiatry event from Bazooki Group and Metabolic Mind. So it'll be really cool. Love to see anybody there. And hopefully we'll be, going around to different conferences and speaking. There's a International Society of Bipolar Disorder in June in Chicago, where Georgia Eid and Shivani Sethi and Ian Campbell are going to be speaking, and we'll have an event there. And so we'll be doing a lot of that kind of outreach too.
Awesome. Can't wait. Brian, anything to close us out?
I'm just excited because, I'm going online too, Arizona, any other state that'll take me now. I had to have residence in Arizona to make this happen. So I'm really excited. And I'm glad that we overlap in a lot of states, Bret. So I can send some people to you and that don't trust my judgment, So that's awesome. No, I think it's just great to have a united force where we can explain the risk and benefits and really educate people and help them get on track, because their neighbor is going to have a different opinion. And I always ask what medical school the neighbor went to, but usually they haven't gone to medical school. So no, I appreciate it. I appreciate all you're doing. And Tro, any final words from you?
No, that's it. Just excited. Awesome. Thank you so much, Bret, for coming on board again. And hopefully we'll see you soon. Maybe we'll get some more updates in a bit from what's going on in Metabolic Mind and your practice, and would love to have you back.
Great. Well, thank you both for the opportunity, and thanks for all you're doing. I mean, it's always good to talk with you, and I look forward to more coming out of you too, and all the work you're doing and the papers you're publishing and all the people you're helping. So thank you.
And Patreon supporters, thanks for listening. I'm glad you got to join us live on this one, and keep doing what you're doing.